everyone. Good afternoon. Hope you all are doing well. Welcome to our March session for our San Joaquin Stanislaus Collaborative. And I hope you all are staying dry in this weather. So just a few quick reminders. Per usual, we are recording this session and it will be the recording will be available afterwards. If you haven't already, highly encourage you to update your Zoom name with your name and the name of your organization. It just helps us keep track of who's in the room. And then for our icebreaker question today, although it may not feel like it with the weather today, I know we're fastly approaching spring. So just wanted to ask everyone what their favorite spring activity is, and maybe that will help us get in the mood. So feel free to drop those in the chat. And then, as always, we want this to be a productive and engaging session. So encourage you to listen in, engage, use the chat function as you have questions, as well as unmute. We want to make sure that everyone gets the most out of this session. So really appreciate your participation and engagement. I'm seeing some comments come in, so I'm just gonna quickly share a few. Some folks are excited about baseball season, playing outside, hiking in the rain, gardening, being warm. I can relate to that. Fishing, going on vacation, spring cleaning. I'm sure some people are intimidated by that. The cherry blossoms, rodeos, walking with my dogs. I see a lot of activities outside, so that's really exciting. I know a lot of us are excited to do that. Okay, so we'll move on. For anyone that's attending this session for the first time, want to give you a warm welcome. Thank you for joining us. The collaborative meetings are a space for Medi-Cal transformation stakeholders to come together to collaborate, identify challenges, and problem solve with the goal of improving CalAIM implementation and driving utilization. So as you join this session, if you have questions come up, please feel free to drop them in the chat or voice them over. But we typically also like to hold space if anyone is new and wants to share a brief intro, to just take a moment to pause, and then you're welcome to just unmute and share a little bit. So is there anyone new that's joining for the first time that would like to share an intro?
Hey, this is MJ from Bay Shelter Homes. I'm very new to this space. Wanted to kind of introduce myself to the group. Still have applied for the TA recipient, waiting to get approved. Once that's approved, I'm going to get into the space of providing the ECM and CS services.
Awesome, great to meet you. Any others?
Yes, hi, my name is Catherine Talongwa. I am one of the local engagement leads for Kaiser Permanente. This is my first time joining the meeting. I'm glad to be here.
Great to meet you. Anyone else? Okay, awesome. So we'll move on. So here's a preview of today's agenda and what you can expect. So we're currently in welcome and level setting. After reviewing the agenda, we will share the session objectives, and then we'll move on to general updates. We have quite a few policy updates from the federal, state, and local level. And then we'll also have our MCPs share updates. And then we also have a regional and provider spotlight. So we are going to have Stanislaus County, their maternal, child, and adolescent health program, share a presentation. And then we will also have a section of today's session around billing and claim best practices, which will help us kind of prepare for our office hours on this topic later this week. And then we'll close out with a discussion around sustainability, and then just share information about upcoming office hours and one-on-ones. For our session objectives today, we will understand and review refinement and updates to the statewide DHCS policy and community support updates. We'll also receive important MCP updates and stay informed on peer activities. We'll explore collaborative sustainability and leadership development by discussing strategies to strengthen local provider networks and enhance skill building for long-term impact. And then we will also gain insight into the Stanislaus County Maternal, Child, and Adolescent Health Program by learning about available services, resources, and how they support the community, as well as how to make referrals. And then we'll also briefly touch on billing and claims best practices in preparation for a dedicated office hour this week. And with that, did also want to make one more quick announcement, which is that Gretchen, who you all know very well, is transitioning off this project. So I do want to just give a few moments for Gretchen to share any words.
No, thank you, Navneet. So very sad to be leaving this great collaborative. It's been wonderful to work with all of you, but I'm sure I will see many of you in the ECM and community support space going forward.
Thanks, Gretchen, and I'll pass it to you again for this next section.
All right, wonderful. So we have a lot of updates to cover and a lot of really wordy slides. I'm not going to cover all of it, but just want to give you some highlights of the things that have been happening, both at the federal level and at the state level, and then we can drill down more into some spotlights for you guys. So next slide, please. So we'll start at the top at the federal level. You may have seen this, but the federal government did make some changes to some of the state guidance about how to incorporate services addressing health-related social needs in their Medicaid programs. And a lot of it caused a lot of concern for folks who are doing ECM and community supports here. But what we have been told is, given that community supports is really falling under the waiver, that these recent changes at the federal level will not impact our community support services at this time. So just want to make everybody aware of that. The state did send out some press releases around this, and this is a language that was in those press releases. Next slide, please. All right, now for the really wordy, very detailed portion of our updates. So back in February, the state did release some updates to community support services for 4 different community supports. And they're listed here. We'll go through what the details are. We also expect the state to release additional guidance around the housing trio of services and transitional rent. And we expect those updates and a new policy guide to come out in April. So we'll be watching for that, and we will let you all know as soon as that comes out. The most important part of all of this is these community supports changes will not go into effect until July 1st of this year. So we have some time to think about it. And I'm sure the MCPs are working on this as well and can probably provide any updates during their section in a little bit. Next slide, please. So we're going to start with the nursing facility transition and diversion to assisted living facilities. I think the really important updates here are around the 2 distinct service components around transition services and around ongoing services for folks who are going to be in an assisted living facility. So just really being aware of that. I think what the state is doing here is really trying to more clearly define what these services involve. And they also want to make sure that we're paying attention to how we overlap with either other community support services or with other programs. So what they're saying for this particular community support services is that folks who get other community supports, it's totally fine to do that as long as there's no duplication of services within those community support services. So that's great. The other thing to be aware of is that we do have other waivers and programs that there cannot be dual enrollment in. So for example, the assisted living waiver or California community transitions, you may not receive those 2 programs as well as this community support service. So just really being aware of what's duplication and what we want to not bill twice for the same individual. Next slide, please. So we'll jump into community transition services and nursing facility transition to a home. And again, some more details around the 2 different components of this community support. One is around transitional coordination of services. And they want to make sure that we're aware of how this may bump up against the PHM transitional care services for folks. And these are different, so they cannot be, this community support cannot take over for the PHM transitional care services. And they really wanted to define more clearly what's involved in the other component, which is the one-time setup expenses. So really defining that more clearly. There's a lot more detail in the guidance, and we'll expect to see more in the new policy guide in April. And again, the state did want to just really make sure that we're clear about what duplication is and how we need to be careful around some of the other waivers and programs that are out there, similar to the previous community support. Next slide, please. All right, here's a big one, which is there anybody here who does asthma remediation? You want to raise your hand virtually, that'd be great. Okay, I got one person. All right, so I will speak to you. So what's happened here is that we had community supports, asthma remediation, and then very shortly after we launched community supports, we did have the state put into the Medi-Cal managed care contract, the asthma preventative benefit, and that went into effect in July. And there's some overlap with these two services. So what the state is clarifying with this guidance update is that folks who do the asthma remediation, you can get reimbursed for the services that overlap either through the asthma remediation community support or through the Medi-Cal benefit, asthma preventative benefit. But after January 1st, 2026, we're going to move all of these services that are in both programs into the asthma preventative benefit. So if you are currently doing asthma remediation services, you may have to become a provider of the asthma preventative benefit in January to continue being paid for these types of services. So just want everyone to be aware of this. And just kind of, if you are involved in this activity, just think about whether or not you want to move to becoming a provider under that benefit. Questions on this one in particular? Yeah, please go ahead, Graciela.
Hi, thank you. I
Sure.
did want to point out, and I know in the guide that was sent over, it does state for managed care plans, we can negotiate with them higher rates, because the rate that would cover, for example, the home assessment is only paying $26 for a 2-hour service. So that rate is right now set in stone, but they're allowing us to negotiate with the MCPs. However, there is a lot of pushback from the MCPs to raise that amount. So that's kind of the struggle that we're having, and we're hoping, I don't know who we can reach out at DHCS to take a look at that and really support us in that, because the home assessment, which we were previously and still are in some occasions charging it to asthma remediation, we're able to charge a much higher amount. But once that goes away, I don't see this being sustainable for that purpose.
Thank you for raising that, and I'm glad you're identifying this early on in the process. So hopefully you can reach out and get your voice heard. So I appreciate that note. Anybody else have any questions or comments or suggestions about how to advocate for higher rates? Okay, well, we'll keep moving on to the next one. The last and final community support update, which is around medically tailored meals and medically supportive foods. So a lot of different criteria going in here. I think the really important one is that we're trying to make sure that our medically tailored meals and medically supportive food services are really geared towards folks who have nutrition sensitive health conditions, and that we're not trying to solely address food insecurity with this community support. So really being mindful of that. There are some new guidance for the MCPs around doing some quality and safety monitoring and oversight of providers. So, many more details was on the slide, but you can check out the full guidance document. And then again, we'll see all of these put forth in the new community supports policy guide. We expect probably towards the end of April. Any questions on this one? All right, so before we jump to the next slide, I'm going to caution you all that we are looking for a lot of feedback from you all on our next couple of slides. So I'm really hoping you guys have all the answers. So we'll go to the next slide here. So the state is really trying to work on how do we increase engagement with our California Children's Services, our children and youth population of focus there. And we're trying to see what kinds of things do you all think could be helpful to providers, to getting this population of focus more engaged and involved in these services. So what we're looking for, and I hope you all have these answers, is what challenges should our TA resources that the state can put out address to support providers and managed care plans. We invite your feedback as well here in delivering ECM and community support services to the CCS population of focus. And please feel free to raise your hand, come off mute. Eliana, I see you come in video, so I'm going to assume you want to join us and give us all the answers here.
No, I don't.
Well, Ileana, go first. Ileana, go ahead.
Thank you, John. I don't have the answers, but I can share a strategy that we've implemented, at least in Stanislaus County. So I want to say like towards the middle of last year, we identified the CCS population of our membership was not receiving those services that are critical. I think that could be leveraged between ECM and the county services. And so what we started some sub work groups with the CCS department. And so that started between just the MCPs and the CCS stakeholders. And then we identified, well, let's bring the ECM providers to join these conversations because we all need to understand what other services are the members eligible for when we're thinking about ECM and CS services. So we've continued those calls on a quarterly basis. And so we actually just had one last week, which we thought, and I'll invite my MCP partners who were there to also highlight any lessons learned from that. But I think what I learned from that is just identifying those right points of contacts. CCS said, call us. We want to know who the ECM providers are. So really allowing that opportunity to network and get to know each other. Something that we also learned, we met last December, I think. So this was our first quarterly meeting of this year. There was a lot of staffing changes. And so that also creates a roadblock in ensuring that we have the right points of contacts on each organizations, even at the MCP level. So we're keeping these conversations sure that we're tracking. We've actually seen an increase in enrollments into ECM services for this particular population. We're seeing an increase in community support service referrals as well. And, I think it all at the end of the day is who are the key stakeholders, who are the right points of contacts that we need to be in the know with in order to connect our members to services, and not just the children and youth who are eligible for these populations of focus, but also their extended families too, right? And so that's one, tidbit of work that we're doing in Stanislaus County, and that's in partnership with the MCPs and with CCS, as well as our ECM providers.
Wonderful. Thank you for sharing. And I'm going to get to you. I'm going to see if the other MCPs wanted to add on to anything that Eliana's shared here.
No, I think she covered it. I mean, I'll flag, I think having spaces for ECM providers that are serving this population to meet each other, to build relationships, to just know each other's names, I think is so important. So in thinking about what resources exist, having those resources be tailored or things that can be easily shared or discussed or leveraged in-person kind of networking activities, I think is always really nice.
Great idea. Health Time San Joaquin, anything to add here? All right, John, I'll turn it over to you.
Yeah, I was just going to piggyback off of what Ileana was saying. I believe this year we reached out to Stockton Unified School District, where we would be able to work closely with their social services departments, because there is a direct link, and when they know that the resources are available out there, because those children very much, and their families, like Ileana was saying, their extended families do qualify for a lot of these services. So in the school district, we found out there's a lot of children that are homeless. There are a lot of families that are dealing with homelessness. They're dealing with asthma remediation. They're dealing with all of those things that are covered under the CS and ECM services. So one thing, not just reaching out to other ECM providers, but you have to reach out to organizations that are working directly with children that are having these needs that need to be assessed. And so working with school districts, I would also say working with your local spiritual groups, churches, they do have youth groups that you could get involved with to let them know these are the types of service that could be very well warranted or attained for those children out in those youth groups. And then, just going out there, the community has lots of what are they called? Community centers that they can go out to. And a lot of youth go out to those places after school because their parents, are telling them, hey, you need to go to these places before you come home. So just reaching out to those local community-based organizations and also, school districts may very well be beneficial for our ECM and CS providers.
Wonderful. Thank you, John. All right, anybody else have any thoughts that we can share with the state around resources, around strategies, around content that could be helpful? All right, I see a comment in the chat. Do we have a database of all ECM and CS providers available for public access? That's a great question that could help with the coordination of services here too. Right. And we do have a variety of different ones. So we do have one that Health Begins maintains. We also have each managed care plan also has their list of providers on the website too. So a couple of different options there. But the Health Begins does consolidate all of the health plan provider information and lets you sort by population of focus, whatever services you're looking for, and in which county you're looking for. Maybe we can drop that link in the chat to that too. All right, if there aren't any other comments or questions, I'm going to keep us going here so we can go to the next slide. So I think the last big update that we have for you guys from a policy perspective is wanted to make sure you're all aware of a big plan that was released last week on March 12th. So the California Interagency Council on Homelessness released a 3-year action plan of how do we prevent and end homelessness. And it is comprised of different parts of the state. So we have Department of Healthcare Services, we have social services, we have a couple of different departments that can get involved in trying to create this action plan. So it was just released. We've had it linked here. And a couple of other highlights that we wanted to bring to you all. So I was unaware of this. I was really excited to learn of this, but the council has also created this homeless data integration system, which is trying to take all of the information from the COCs, the HMIS systems across the state and put it into one system. So they're starting to do a lot of data analysis. And they're also starting to share that with Department of Healthcare Services, Department of Social Services to try to match which individuals are using which public programs as a way to help really serve folks in the best way possible. So more to come on that, but super exciting around the data front. And then there was a briefing last week that the California Healthcare Foundation did. They had a lot of panelists up there, and there's a lot of great information shared about the individuals who are experiencing homelessness in California, how it may interact with ECM and community sports. So dropped a bunch of those resources here, but encourage you all to check that out if you're working with this population of focus. Navneet and I were both there, and it was a really great webinar. So happy to share all that with you. All right, let's see if there's anything that getting all the databases in there. Okay, wonderful. So now I'm going to turn it over to the managed care plans. They can share their updates. And I think we have up first the health plan of San Joaquin. Anybody on from health plan? I'm not seeing anybody, so I may move us along. If you want to go to the next slide. Oh, did I hear someone? Oh, nope, that was just Elliot. Okay.
That was me. I'm barely getting
like, okay, I'm here.
Thank you for the opportunity to provide updates. I don't have any slides to provide today because I think, Health Begins did a great job covering some of those updates in regards to the new definitions for some of those community support services. Just a quick update in regards to, there's a lot of work that the MCPs are doing in regards to transitional rent, to different aspects of the implementation process within CalAIM and some of those changes. A big lift with the Justice Involved Population of Focus. We went live in San Joaquin County early this year. So we're starting to see some of those referrals come in. We're hoping to provide a lessons learned update in the upcoming meeting. So we're looking forward to that. In Stanislaus County, we're expected to go live in January of next year. It sounds like a long time from now, but we're actually working with the correctional facility and different departments actively, and we're meeting on a monthly basis just to ensure that we're getting them ready to go live. There's a lot of lessons learned that we've learned from other counties in which we've gone live. In the previous meetings, we also share those updates in regards to the referral forms. There's some alignment there and some standardization around the ECM and CS and the ECM referral form, for both adult and children across the MCPs. So we can definitely reshare that information. But really, here's an opportunity. If you have any questions about the work that we're doing, Graciela, I heard you say, there's questions about the MCPs and some of those rates. If you have any questions, we can definitely drop the information for our contracting team so you can have those discussions with them. I'm not sure if you reached out to us yet, but definitely an opportunity there to engage in those discussions. I also put my information in the chat. Feel free to reach out to me with any questions for our current or any potential new providers. Always free to have a conversation and discuss how the implementation is going in these two particular counties around CalAIM.
Wonderful. And we had a question in the chat about how folks can update their services and contact information in your provider directories.
Hi there, Richard. I think that might have been for me.
Just for Kaiser. Okay.
Message Roberta back, but happy to address that. Feel free, if you see the directory and you're like, oh, I think we should include an updated phone number, feel free to reach out to myself and to, if you're contracted with one of our network lead entities, include your kind of primary NLE contact, and we can make sure to get that information updated.
Okay, wonderful. I think, Camille, you're up next for MCP updates, so we'll just turn it over to you.
Great. Thanks so much. Okay, well, before I get into a couple of the quick slides that I provided, echoing Eliana, appreciate the kind of new CS service definitions. And again, a lot of the managed care plans are meeting kind of collectively to think about how we can approach transitional rent strategically across the board, so that we're all not going at it independently and working in silos. And so we're still waiting for DHCS's guidance that's supposed to come out in April. We're really looking forward to seeing what comes out of that. Agree, the webinar that CHCF hosted last week was great and really useful information. Definitely recommend folks kind of watching that webinar recording when it's available or if it's already posted. And yeah, I can get into a couple of quick updates. You can go to the next slide. This is just a reminder that if you are contracted with one of our network lead entities, to please submit your referral directly to your contracted network lead entity, NLE, rather than Kaiser Permanente, to ensure that you see that member return back to you. This is particularly important for our ECM providers that would like to take advantage of streamlined authorization. For our contracted ECM providers, streamlined authorization means that you can begin working with members right away, only for ECM providers. It allows an authorization period up to 30 days, and the authorization period is up to 30 days to the date KP makes and communicates the authorization, whichever comes first. Providers will be paid for the 30-day ECM authorization enrollment. So that means that if you're an ECM provider, you're subcontracted with one of our network lead entities to provide ECM services, you can start providing services for that member on day one, as long as you make sure that you send that referral to your network lead entity. Please reach out if you have any more questions. We're hoping to push out some more education through our NLE partners, which I'll get to in a second, but feel free to reach out. You can go to the next slide. This is just a reminder of how you can make those referrals. In Northern California, you can send your referral either by phone. You can send the referral form to that email listed kind of on that bottom left box. And again, if you're contracted with a network lead entity, please send that referral directly to your NLE. And again, Kaiser has a no wrong door approach for referrals. You can use Kaiser's referral form. If you don't have Kaiser's referral form on hand, you can use another managed care plan's referral form. We will accept referrals from anyone, anywhere, whether that be you're sending a referral on behalf of your neighbor or for yourself, or your doctor sends it in for you. We will accept it any which way. We can go to the next slide. Speaking of our network lead entities, so for those that might not be as familiar, Kaiser Permanente partners with 3 network lead entities in Stanislaus and San Joaquin County. We have just the 2, Independent Living Systems and Full Circle Health Network. You can contract with these hubs, NLEs, network identities, to begin providing services for KP members. For prospective providers, you can join these new prospective provider office hours. And if you are contracted already and have questions about anything that's going on, you can join one of the contracted providers office hours for ILS. There are 2, the 2nd and 4th Thursday of every month, and then Tuesdays, every Tuesday for Full Circle Health Network. You can go to the next slide. And then these are just contact information if you don't already have them, for our ILS specific reps across our region. And then last but not least, I have a quick update. You might remember over the past several months, we've been pushing out this complex care certificate. It was a free training resource for Kaiser Permanente. I just want to come back here and say that all 2,000 of our codes have been redeemed. We had over 30 community members take advantage of the certificate. We're still sorting through all the data because a lot of where folks were saying they were from was kind of self-described. But we're super excited to kind of use up all of our resources. Obviously, we had 2,000 people kind of leverage it. We had 2,000 codes. And we saw utilization across our ECM, CS, and CHW providers, at FQHCs, county staff, health system employees. So super excited to have kind of used up all these resources. If you have registered, if you've used your code, you've started, but you haven't quite finished, and you are no longer able to get back in, we did learn that I believe that there is a 12 to 18th month timeline for these services. Most people have already completed, but if for some reason you haven't yet and you're having a hard time accessing, feel free to reach back out to me and we can extend the deadline for you to just make sure that you can continue to have access to the resources. And that is it, I think, for me, for Kaiser Permanente.
That's wonderful. Congratulations, Camille. All right, so now I'm super excited for our provider spotlight. We have Julie Falkenstein from the Stanislaus County Health Services Agency, who's going to come talk about the maternal, child, and adolescent health program at the county. So Julie, I will turn it over to you.
Thank you. Do I have the ability to work the slides, or is that?
You can go ahead and request Navneet to forward it for you. Yeah.
Okay, how do I request?
Just say, next slide.
Oh, sorry. I'm thinking okay. Technology. You're thinking
old school.
Old school, real simple. Okay. So I'm Julie Falkenstein. I'm a public health nurse manager with Stanislaus County, and I am our maternal, child, and adolescent health director. Among other things, I oversee all of our home visiting programs, and that is what I'm going to tell you about today. Next slide. So this is just a kind of placeholder slide to give you an idea as to what 4 programs we're going to talk about. Next slide. So I started to write this on every program slide, and I was like, we're just going to make it really simple, because there are some very key things that are the same in all of our programs. So everything is free and voluntary. Everything is strength-based. So our goal is to seek out the client strengths and to build upon those. We offer a comprehensive assessment. So it's not just a medical assessment. It is psychosocial, it's financial, it's environmental. Like, we cover all of it. The service plan that's developed is client focused. So the client helps us create that service plan. In addition to that, the goals that we work on with the clients are specifically their goals. Regardless of our opinions on their goals, they're their goals for what they want to be working on next. We provide linkages to services that they need. We provide case management and care coordination, and we provide a fair amount of education that is very tailored to each family itself. So next slide. The first program is called Adolescent Family Life, and it's actually a 2-part program. So there's AFLP and then there's CalAIM. Essentially, they are the same program, but CalAIM is specifically for clients that are on TANF. This meets their welfare to work requirements. So we're looking for folks that are under the age of 21 that are pregnant or parenting. It could be the parent that holds custody. It could be the non-custodial parent. We serve men and women both, so we are open for everyone. It's an evidence-informed model that's based on positive youth development. It's designed originally by the state. The people that work in the program are community health workers, and then we have one public health nurse. So it's actually 2 community health workers and 1 public health nurse. And they go out and they provide home visits. There's a focus on educational attainment, and then delaying subsequent pregnancies. Unless that is, again, the youth's goal is they want their children close together. So an educational attainment can look like a lot of different things. It could be finishing their GED. It could be going to MJC or to Stan State. We help them navigate all of the nuances of FAFSA and grants and all of that, how to get connected with folks at either facility or either agency, and get the support they need there as well. There's a booklet called My Life and Me, which goes through just kind of, because it is adolescent development focused, it kind of goes through all of those developmental milestones that we see adolescents need to work through, and some of those big choices and changes that they need to be making as they become independent and are raising their children. It is a pretty remarkable program from that standpoint. So, but you may hear me say that more than once because I kind of think all of our programs are fabulous. If you go on to the next slide. Healthy Families Stanislaus is an evidence-based program. It is Healthy Families America on the national level. On the local level, it's Healthy Families Stanislaus. We are currently open for pregnant and parenting families with children under 3 months of age, unless we seek a waiver from the national office, which we can do. We're looking at probably in the next year moving to a child welfare model that would expand who we provide services to. So we could actually then provide services to families with children up to the age of 5. And right now we provide services through the age of 3. And that would also expand the timeline that families can receive services. If I go back to AFLP real fast, families receive services for, I think it's 2 years. But then that is something that, depending upon where the family is, we can get extensions on that. So if you come into the program at 13 or 14, we're not going to close your case at 14 or 15 or 16. If you want to continue to have case management for AFLP, we will continue to keep you open for as long as you're wanting those services. So back to this one, it's also a multidisciplinary team. We have community health workers, a social worker, and a public health nurse. You'll find that both of our programs that are community health worker models have nurses, public health nurses in them. And that is because we find with the high-risk populations, sometimes people need a nurse and they need that extra level of expertise and assessment and education. And so our nurses both carry a caseload, but then they also partner with the community health workers and the social workers to make sure that any medical needs are being met. So people can see a variety of people within these teams, depending upon what their need is. So Healthy Families Stanislaus, the focus is really on parent-child interaction, and nurturing that relationship, and then supporting the overall environment around the family with a lot of parenting education and support, and work to get attached to the resources the family needs, and kind of increase families' knowledge of how they're raising their children and what's developmentally normal. That's actually one of the fun things with this is that we did a survey of our parents, and one of the things that came up is, I know that my child's behavior is normal. I know how to respond to it. And I can tell you what my last goal was and how we achieved it. And I just thought those were really important things for families to be able to identify. Our next program, if you can hit the next slide, is high-risk maternal child health. The name is slightly deceiving, and I'll tell you more about that. Technically, the population we serve here are high-risk pregnant and parenting women and their families. We get a lot of medically high-risk children that typically don't qualify for CCS, so they don't have a CCS condition. And the families have a number of social barriers. All of our families, we see a lot of mental illness, domestic violence, and substance use. And they're all very intertwined with each other, which anyone who's providing services in the community starts to recognize that they all kind of interweave together as families are working to maintain themselves. It is a generalist public health nurse program. So this program goes back to the day of walking through the tenements and meeting families and working one-on-one with a public health nurse, working one-on-one with a family. And so with that, every client you see is different within this program. No two families are the same. It's got a very broad target population. Our nurses in these programs know more about obscure genetic diseases or just like odd things that can happen within a family, in addition to all the normal things that happen within a family. They're a pretty neat group of nurses. The focus is on the overall health of the child and family. And I will say that we do sometimes get referrals that fall outside this eligible population. Sometimes it's an adult, sometimes it's a developmentally delayed sister of a client, or like just kind of pick a topic. It's someone who's falling through the cracks and needs some intensive case management to get back on track again. And so we will pick up folks that are outside this population just because we recognize the need and we know that there are not always services that folks can access. So next slide. Nurse Family Partnership is almost the last program I'm going to tell you about. This is for pregnant people who are less than 28 weeks gestation that qualify for WIC. NFP requires a low income marker. For Stanislaus County, something like 70% of the pregnant women in our county are eligible for WIC. And so that opened up the eligibility as much as we could in choosing that as our marker. And so it is very focused. It is an evidence-based program. It is very focused on healthy infants, healthy pregnancies, healthy moms, healthy babies. It's a fairly intensive case management program, and also another program where there's a fair amount of education that is tailored specifically to that family. And because it's specifically tailored to first-time parenting parents. So you could have been pregnant and had a baby but not parented that child. You still get to participate in this program if this is the first child you're parenting. And so that could be due to child welfare, that could be an adoption choice, that could be a miscarriage. Like there's lots of reasons why people fall into that category. So, and then the last program I want to tell you about is one less because you will refer to it, but one more because you might want education for it. through it for either yourself or the folks, your coworkers, your team, or for your clients themselves. So SIDS is sudden infant death syndrome, and we target parents and caregivers. So families, grandparents, aunt, uncles, child care providers. If you interact with a child and provide care to a child, you are part of our target population. And we provide education to prevent infant death. And we also provide family support through the grief and loss process. And so if you have a family that has a child die due to a sleep-related death or a sleep-related reason, it would likely get referred, well, it should always get referred to us. And we will make contact with that family and go out and provide support. You're always welcome to reach out to us if you have a family that you think needs some support, or if you just want to provide education. Like, we're very willing to go out and do educational programs for groups of people, because we have way too many children that die due to sleep-related causes in this county. Any is too many. We have more than just any. And most of the time our parents don't realize that there are other choices they could make. Their intention was not to kill their child. It's never to kill their child. And so the more we can provide education, the better tools we can offer our families. So those are our home visiting programs. You can hit the next slide. And this is, I'm going to drop the referral form into chat as well as soon as I'm done talking. But there's lots of ways to make a referral. You can find the referral form at that link. You can send it via email or fax to us. You can actually just call us and tell us you want to make a referral. And we have 4 amazing clerical folks who will just take down all the information and ask all the questions. And you can do a referral form that way. We appreciate as much information as we can get. 1, it helps us know what we're walking into, but 2, it helps us triage. And so if what you send us is, pregnant women, 30 or 26 weeks, we know that would go to the NFP program, but it might go on the list for a couple, like it might land on a waiting list, when in reality, she may have other things going on in her life, which means she needs to not sit on a waiting list for 2 weeks. She actually needs a nurse to call her the next day. And so any additional information is always really appreciated, so that we can make sure we can provide the best resources and the best information for folks. Other questions? I just talked a lot and fast.
Lots of great info, Julie. It was wonderful.
So
Any
anyone
questions? Yeah. Feel free to put in the chat or come off mute if you have any questions for Julie. Okay, we're not seeing any, but if you have some that come up, let us know. We'll definitely get them to Julie and get the answers sent out to everybody. But Julie, thank you so much for being here. That was a lot of great information, and really appreciate your time.
Yeah, and I'll get the link set into chat.
Awesome. Thank you so much.
Thank you.
All right, so yeah, read my mind, Navneet. So want to take a moment here to pause and see if you all have any updates that you'd like to share with all of us about any upcoming events or meetings, any successes. We always love to hear about successes you've had with the clients you're working with in ECM and community supports. So I'll just pause for a minute to see if we have any spotlights from you all on screen. Right, so I'm not seeing any here, Navneet. We'll go on to the next slide. So we would love to hear from you, whether it's in these agenda items in the meeting, or if you have things you'd like to share, any events or resource fairs that we can support, please let us know. So just reach out and let us know what's happening, and we can spread the word, and we can also support you however we can. So look forward to hearing about things you guys are working on. And we will keep going, because I know we're a little behind time here. All right, so I'm super excited for this next agenda item. We talked about this last month when we were all together. We're really trying to do more to support you all with billing best practices. We are going to have an office hours on Thursday around all of this, but here to gather some more information to make our office hours as effective as possible. We have Angela here, who's going to cover the next few slides. So Angela, I will pass it on to you.
Thank you so much, Gretchen. So good afternoon. My name is Angela Ayala. I am a billing and collections expert, if you will. It's always hard to say that, but I'm here to kind of talk about some billing basics and give you guys sort of the opportunity to ask questions, and more than anything, have a good know what is available to you guys during office hours. We want to encourage you guys to come, bring your the identified case samples if you guys are going through denials, so we can kind of tailor these sessions to things that are actually happening in the community to our providers. So today I am going to talk about the importance of accurate billing. And accurate billing starts with correctly assigning units and using appropriate modifiers. These elements ensure that claims are processed correctly, reimbursement aligns with services provided, and it is compliant. Our claims are compliant with Medi-Cal guidelines. So in this section, Naveed, if you can go to the next slide, please. We will talk about unit assignments for ECM and community support services. They have specific billing criteria that must be followed when we submit our claims or our invoices. And sort of this is one of the stepping stones of accurate billing. So it is important that we understand how to correctly assign units for the services we are providing. And as I mentioned before, to make sure that our claims are being processed correctly and we are getting reimbursed correctly as well, right? So our units really depend on the service that are provided. They are measured in different there are different units of measures for our units. They can be per time, per diem, per month, or lifetime benefits, right? So it's important for us when we submit our claims that we understand that we cannot use partial numbers. We have to submit units as a whole. For outreach services, typically our units are based on 15-minute time lanes. If we have unsuccessful outreaches, we are still entitled to submit a claim for that service, and it would just be 1 unit for that. For other sort of time reimbursed services, DHCS asks us to use the rule of 8. So Naveed, would you mind please going to the next slide? And so this information was taken directly from the DHCS guidelines, and typically it just depicts really that rule of 8 item that I was talking about previously. So if you're interacting with a client for 8 minutes, then you are entitled to bill for 1 service. So even though our time intervals are for 15 minutes as a unit of measure, you don't necessarily have to be interacting with the patient for 15 minutes, right? As long as you are in communication with the patient, or that outreach effort has a length of time between 8 to 22 minutes, then you would be billing for 1 unit of time. And so from 23 to 37 minutes, it would be 2 units of time, and so forth. Do we have any questions on how to assign the rule of 8 for our unit assignments? Nope. Next slide, please. And so this slide kind of depicts a few case samples that I wanted to share with you guys. So if you have any confusion around the unit of measure that is pertinent to the service as being provided, your approved authorization details are a good reference point for you to understand how to assign specific units for services upon submitting your claims. So I have 2 examples here. The first one is for an ECM service for case management support for a non-clinical staff. You can see under auth start time and auth end time that this authorization is good for 6 months. Under assignment number and rec number, you see 6, which indicates the number of units this authorization has been approved for. And then under frequency, you can see sort of the unit of measure, right? So in essence, this service for this patient was approved from February 20th to August 20th. So it's a 6-month period. And so that indicates that when you are submitting a claim or an invoice for this service, for monthly reimbursement, you would submit 1 unit. Does that make sense to everyone? Yes, no, maybe so. Okay, and so, yes,
Angela,
go for
can I add something to that?
I'm sorry?
Can I add something to this?
Sure, of course, yes.
Yeah, so with the required, like, say, for instance, 80043, HealthNet actually allows you to put 6 for 6 months. As per Health Plan of San Joaquin, they're the ones that are asking for, like, 180 units. So you just have to be aware of what the managed care plans are asking for also. So that is a good discussion to have with the managed care plan on what they're looking for also. So this is great that you're bringing this up, Angela, because both Health Plan of San Joaquin and HealthNet sometimes ask for different units of measure for those. So this is great. Thank you for this.
Yeah, no worries. And so thanks, John, for referencing sort of that second example. So the second example, the authorization references that service on a per day basis, right? And again, you can see that the service has been approved for a 6-month period. Reimbursement is housed per diem. And so because it's per day, the number of units that have been approved for that service is 180 units, right? And again, as John referenced, really it's just up to your health plan on how they would like those claims to be submitted. But in essence, what this authorization is telling you is that you can submit 1 unit per day for that service. Do we have any questions on that? Nope. Okay, let's go on to the next slide, please. Okay, yes. Eliana is saying that they discussed this during onboarding, but please feel free to reference your contract. Okay, and so then this second item that we wanted to talk about today was modifiers. Modifiers provide essential details about the services that we provide. They indicate the modality of service, where the service happened, who performed the service, and other additional considerations. By applying the right modifiers in the right scenarios, we streamline billing processes and maintain regulatory compliance. And so what I've done here for you today is I've sort of provided the modifiers that are typically used for our ECM services versus modifiers that are typically used for our community support services. And so for enhanced care management, you typically see 4 different modifiers used. U1 would indicate that the ECM service has been performed by a clinic licensed staff. A U2 modifier would indicate that the ECM service is performed by a non-clinical staff, and I have examples of what those roles are in the next following slides. And then a U8 modifier is for outreach services, right? So they're not necessarily part of ECM. The patient's not necessarily part of ECM yet, but we are reaching out to our patient to see if they want to participate in ECM program. And then the GQ modifier would indicate that the service was provided via telehealth or via phone. For community support services, the most popular modifier that you will be using when submitting claims is our U6 modifier. So for any type of community support service, if it's not exclusively indicated, you will use a U6, which denotes generally that it's a community support service that's been provided for the patient. There are two different services that use similar HCPCS codes, and so that is where the U2 through U5 modifiers would be used. So that is H0043 and H0044, which is our housing benefit. So for housing deposits, you would be using H0044 U2, but if you are indicating short-term post-hospitalization housing per day, I think, you would be using a U3 modifier. And so for short-term post-hospitalization housing, you would be indicating that type of service with a U3, even though the HCPCS code that you are using is similar to the one that you are using for housing deposits and navigation services. And then your U4 modifier and your U5 modifier is used for nursing facility transition benefits. And so the U4 modifier indicates that your nursing facility transition you're transitioning to home, and your U5 modifier indicates that you're transitioning to an assisted living facility. So that is sort of the information that I have on modifiers. And if you can go to the next slide, please. Here for your modifier U1s, I have some examples of what a licensed provider would be. Of course, your MD, a licensed practical nurse, an LVN, essentially any sort of medical provider that requires a license in the state of California to provide care would fall under this U1 modifier. And then Naveed, if you can go to the next slide. Your U2 modifier would be for like your medical assistants, your community health workers, your doulas, any staff member that does not require a license would fall under this modifier. And I think that's really all the slides that I have. Naveed, can you go to the next slide? Yep. Oh, yeah. And we have a poll for everyone. I'm here if you guys have any questions, and I'm looking forward to seeing you guys during office hours.
Thank you, Angela.
Mm-hmm.
So looking at your poll or your presentation today and just asking you about how helpful this information was. So appreciate everybody filling that out. All right, now you let us know when it's slowing down. Great. Wonderful. So thank you all for filling out the poll. It looks like your presentation was very helpful. So thank you, Angela. Look forward to office hours later this week.
Thank you.
All right, so we have a few more things to cover. So one of the things we wanted to start talking about, you can go to the next slide, Navneet, is community sustainability for our PATH collaboratives, for the work that we've been doing in our CPIs. And while we anticipate being part of the collaborative through 2026 at Health Begins, we do want to start to think about ways that we can work with everyone in this room, this virtual room, to think about how to carry on the pieces of the CPI that are really beneficial to all of you. So one of the things we thought we'd start with is looking at what are the goals of our CalAIM programs. And some of those are really to look at how do we address California's physical and mental health needs, which you all are doing through ECM and community supports. We want to really improve and integrate care for Californians. And I've seen a lot of that happening through the CPI with folks working together, networking, sharing information, best practices, lessons learned. So that's been super exciting to see that starting to happen in the CPI. We know a lot of you are working towards being that catalyst for equity and justice with the clients that you work with and the programs you're involved in. And then we also have been seeing a lot of work from all of you about how do we build a healthier state through these two programs. So that's been very exciting to see. We also know that PATH, when the state has looked at how do we look at the CPIs and the role that they play in ECM and community supports and meeting these CalAIM goals, it's really trying to break down those silos, having folks work together to identify, discuss, and resolve topical implementation issues with ECM and community supports. So it seems like that all the work that you're doing has really been driving towards meeting the CalAIM goals and the goals the state has set forth for the PATH CPI. So that's wonderful. We want to talk about today in our first conversation around community sustainability of our collaboratives, and we can go to the next slide, Navneet, is we know what the state set out for CalAIM, for CPIs, but what we want to know is what's been valuable to you through the time you spend in this collaborative. And that can be networking, it can be learning about, billing codes, it can be whatever has been really valuable to you. So we'd love to have folks put it in the chat or come off mute and share some of the things that have been most valuable to you in our CPI. What brings you guys to these meetings every month? Is your birthday, say community networking with like-minded individuals? Great. John, what brings you back to these meetings every month? I'm going to pick on you since you're on camera.
I would just say a lot of the information that you provide, Gretchen, in regards to all the updates. Not every day that I can get on the DHCS website and read what's coming up, the changes. So this is a great opportunity to hear all the changes that are happening with DHCS, in regards to CalAIM and ECM and CS, knowing what's coming up in April. That's where, I love the networking. Don't get me wrong. I love meeting people on here that are providing the same services, that are being impactful in the community and helping people through ECM and CS. But for us to be able to provide that, we need to be informed. And so this is just another opportunity for us to be informed. Like I said, a lot of information comes out from the state, and it's great that the CPI has been able to put all of that information in an easy place to digest it, ask questions, and be able to get some honest feedback. And so this has been a great opportunity for the CPI to provide that information. So just getting updates is really a great platform for the CPI.
No, that's great to hear. Thank you for sharing, John. And I think a lot of your colleagues are agreeing with you that getting that real-time information, ability to ask questions is important to them as well. We're also seeing a lot of people say learning from their peers, linkages. I think some folks are the only provider in their organizations, having a chance to come network with other providers has been really helpful. What else for folks?
I'll share that from an MCP perspective. I think it really breaks the silos of information sharing, right? You know, we meet with our providers, we provide information, newsletters, but I think this forum really brings the policy as an overview and how it is applicable to all providers, even those who are interested in becoming providers. So I think I really appreciate, you know, even you providing the new definitions for the CS measures. I think that's really helpful to hear it as a umbrella update rather than an MCP specific update. So I really appreciate all the topics that are lifted here, as well as the in-person networking events. You know, the one we had last month, I found it so valuable. Met new providers, met prospective providers, and answered questions to those providers that I typically don't get to see because those questions are usually routed to somebody else. But again, I really appreciate the opportunity and the space to be here and share updates, but also hear from you guys on the Health Begins team as well.
Thank you, Eliana. And Camille, I see you put in some things in the chat as well about getting those updates. So I think that's really important to have our MCPs also be here. I know we get a lot from you guys, getting to network with you and hearing your updates and getting to interact with you every month. That's really important. Anybody else want to jump in and share anything? Right. Well, as you guys think about different things and different reasons that bring you back to this, we'd love to hear them. And again, we're just starting the conversation now about community sustainability, and we'll be doing some more check-ins on this over the next year and a half as we think about what pieces we want to keep of the CPI and how we want to transition them. So, and if you have ideas of how to do this, we would love to hear those as well. So appreciate your participation and feedback. And I noticed Health Plan of San Joaquin has joined, and I wanted to take a few minutes, if we can, to see if you had any updates you wanted to share to the CPI.
Thank you so much. I apologize. I was late, so thank you everybody for your patience. Not many updates. You know, I just wanted to share. You know, I'm thankful for even our MCP collaboration, right, amongst the 3 MCPs in the counties. We've really created a strong partnership between Kaiser, HealthNet, Health Plan San Joaquin to be able to provide, you know, information and information sharing back to our provider community. So appreciate this forum, Health Begins, and bringing us together to be able to converse, right? Keeping, you know, conversations open, updates open, because a lot is coming down the pike. As you know, transitional rent is around the corner. A lot of us are heads down, waiting for that guidance, because that's going to be the next mandatory community sport. I'm sure you all talked about it today. I'm not sure. And then, of course, you know, getting prepared for setting up that provider network as well. I don't know if anybody had questions for me specific to Health Plan San Joaquin, but I don't want to repeat anything that you all spent the last hour on.
Great. Do you have any questions? Well, thank you for joining, and you joined at just the perfect time. So I'm glad we still had a few minutes left. So wonderful. All right. And I think Navneet, I will turn it over to you now.
Awesome. Thanks, Gretchen. I know we covered lots of great information, and we will also send out the slide deck in our post-event email. So don't worry if you felt like you missed anything, you can always go back and reference. So just wanted to share some quick next steps. We've been talking about through the session, we are hosting office hours this Thursday at 11 a.m. through 12 p.m. With Angela, and we will be talking about billing, claims, and coding. Just a few topics to note with this office hours. We'll be talking about best practices, talking about billing for CHWs versus ECM, assessing and managing challenges, as well as please feel free to bring case examples that are de-identified and don't have any personal information. So we'll drop that registration link for office hours, but we'll also send it out via email as well. And then, as always, just wanted to make sure we uplifted that we do have opportunities for one-on-ones if that is something of interest or need. Happy to talk about any of the topics that we've kind of listed on the slide, as well as other things that may come up. So if there are questions or you feel like you need some time to just have a quick one-on-one to get some of your questions answered, please feel free to email me at navni@healthbegins.org. I'm sure everyone on this call probably already has my email since I send out all those emails. But yeah, just if anything comes up, please feel free to reach out via email, and we're here to support you. That's it for today's session. Want to thank you all for coming here today. Hopefully you got lots of information from our session today, and I look forward to seeing folks on office hours later this week. Thank you.
Thank you, guys.